I finish my internship, and I start my private, sort of holistic practice. And I also need to make money. So I ended up getting a job and getting trained as an ER doctor. And so I end up seeing, scores, hundreds, maybe even thousands of people with chest pain, some of whom were having heart attacks, some of whom thought they were having heart attacks. But my job was to evaluate them and see which of them were having heart attacks and then refer them to the cardiologist. And so I became used to dealing with heart patients. And like always, I started asking myself some questions and didn't say much about it at the time. So here's sort of how that went. I said to myself, okay, if all the blood goes through these three major vessels, all the blood to the heart, and one of them gets blocked with plaque, that's what causes the heart attack. So the question I asked myself, is the blood everywhere in the body the same? In other words, there must be something in the blood which is precipitating or settling or somehow doing something to the arteries so that this blockage happens. So again, is the blood that goes through the coronary arteries the same as the blood that goes through, say, the splenic artery, or that's the artery to the spleen, hepatic artery to the liver, femoral artery to your leg, foot artery, brain artery, liver, kidneys, all the rest of the arteries? And obviously the answer is yes. Nobody, as far as I know, thinks that you have a special blood that only goes through your coronary arteries that's different than the blood going through the spleen artery.